So in today's Unlocked briefing section of the Pharmacy Unlocked newsletter, I talked about something that I'm seeing more and more in healthcare. A lot of physicians are moving towards concierge and direct primary care models. Smaller practices, more time with patients, more personalized care. And on the surface, that sounds like the solution to everything, but here's what actually happens. The more time you spend with patients, the more complexity you uncover. And nowhere is that more obvious than with their medications. I mean, think about it. When was the last time someone actually sat down and reviewed everything a patient is taking? Not just their prescriptions, but supplements, over-the-counter medications, changes over time that's happened, what they actually take versus what's on the chart. Because in reality, most patients, especially with chronic conditions, are on multiple medications layered over years, often by different providers. And even in a concierge model, that gets hard to manage. That's where pharmacists come in. This is literally what we're trained to do. We're trained to look at the full medication picture, catch interactions, simplify regimens, adjust based on the patient's lifestyle, and make sure everything actually makes sense together. Not just on paper, but in real life. And when you bring a pharmacist into these care models, things start to shift. Medication reviews aren't just a one-time thing, they become ongoing. Decisions get more intentional. You start deprescribing what's not needed. You align treatment with how someone actually lives. For patients, it's safer, clearer, and easier to follow. And for physicians, it's less guesswork and more confidence in every decision. And that's really the bigger point I get into in this article, is that if healthcare is moving towards more personalized, relationship-based care, medication management can't stay reactive. It has to be a core part of the team, because medications are powerful, but without the right oversight, they're also where a lot of things go wrong. If you're in healthcare or even a patient navigating multiple medications, this is something worth thinking about. I break this down deeper in the full article, especially where pharmacists fit into the future of these models and why it matters more than people realize. Make sure you go check out the article on pharmacyunlocked.com. And if you're not subscribed already, make sure you subscribe to the newsletter, as we have exclusive content that goes out exclusively for our subscribers. See you next time.